Centuries before drills and anesthetic shots existed, doctors still had a way to try to silence tooth pain. They used herbal smoke to pull out the cause. Imagine sitting in a candlelit room while an herbal mixture smoldered nearby, because people believed a tiny tooth worm or trapped creature was chewing on the root, driving the ache deeper and deeper. Early dental theories were simple and vivid. If the pain came from something living inside the tooth, then a powerful, fragrant smoke might drive it away or force it out. The process was careful and step-by-step. First, the healer chose strong-smelling herbs, plants believed to fight bad humors and calm pain. Next, the herbs were crushed or dried to release their scent and strength. Then a small fire was prepared, and the mixture was placed on hot coals so it would smolder rather than burn away too fast. When the smoke began to rise, the patient was brought close so the fumes could be guided toward the sore tooth, often using cloth or simple tools to keep the smoke directed. Finally, the treatment was repeated in short sessions because the belief was that steady exposure, like a gentle hunt, would make the source of pain retreat. This wasn't modern dentistry, and that's the point. Without trained anatomy, sterilization, or anesthesia, doctors focused on what they could control, symptoms and causes they could imagine. Today, we know tooth pain usually comes from decay, infection, inflammation, or a damaged nerve, and treatment means cleaning, filling, root canal work, or pain relief with precise medicines. But the historical urge to chase relief with herbal smoke reveals something real. People were trying to understand suffering with the tools they had, searching for a cure long before science could explain the true source. And as strange as it sounds, the method endured for generations because it offered hope when nothing else could touch the agony. Why doctors used smoke for tooth pain? Smoke was used for tooth pain because earlier doctors believed irritation in the mouth could be calmed by forcing warm, fragrant air and plant vapors toward the problem area. In many places, herbal preparations were one of the few tools available for inflammation and infection-like symptoms when there was no modern dental drilling, proper sterilization, or reliable medications. Toothaches were often treated as a local sickness in the gum and tooth rather than as a specific problem with nerves and bacteria, so smoke seemed like a direct way to affect the painful spot. A common early theory blamed a tooth worm, a creature thought to burrow in the tooth and cause sudden, throbbing pain. People described the sensation as if something inside the tooth was chewing or moving, and remedies were aimed at driving the cause out. Herbal smoke fit that idea well, because the burning material produced heat, odor, and a steady stream of vapor that practitioners claimed could drive the supposed offender away or soothe the inflamed tissues around it. Doctors typically prepared herbal smoke treatments in a careful, step-by-step way, using whatever dried plants were at hand. First, they selected herbs known in folk practice for cooling, warming, or cleansing effects, such as resins, aromatic leaves, or bitter-smelling botanicals, then dried or crushed them so they would burn more evenly. Next, they lit a small amount on a coal or ember in a covered container so smoke would be directed instead of drifting away. When the smoke reached a steady flow, the practitioner would aim it toward the affected side of the mouth, often by positioning the person so the smoke could enter the mouth space without burning the face. Then the treatment focused on timing and repeated exposure rather than cutting or extracting the tooth. The person would sit still while smoke was allowed to reach the gums, sometimes with brief pauses so the heat stayed tolerable. A practitioner might also combine the smoke with other simple measures like gentle rinsing using herbal infusions made from the same plants. But the core action in this method was the vapor and warmth delivered by burning herbs. Because there was no anesthesia, no dental instruments designed for infection control, and no ability to remove decay cleanly, smoke offered a non-surgical option that could be delivered quickly and without tools that could worsen the pain. This approach differs sharply from modern dental science, which identifies toothache causes more precisely, such as cavities reaching the nerve, gum infections, cracked teeth, or abscesses. Today, dentists use diagnosis with exam and imaging, then treat the specific source, often with procedures like fillings, root canal therapy, or drainage of an abscess, along with anesthetics that allow careful work. Smoke does not eliminate the bacteria that cause most tooth infections, and it cannot remove dead nerve tissue or clear a blocked root canal. so it would be considered unreliable as a standalone cure. Still, the historical practice shows how people tried to manage pain with the limited resources they had, using heat and plant vapors to calm symptoms while they lacked the tools to treat the underlying dental damage. How herbal smoke treatment worked. Tooth pain in many old communities was treated with herbal smoke because it seemed to calm inflamed tissues and dull sensation when there was no modern dentistry or anesthesia. People also had early dental theories that tried to explain the pain in a simple way, and one of the most persistent ideas was that a small tooth worm lived inside the tooth and chewed the cause of the ache. Even when no one could see anything in the tooth, the theory fit everyday observations. Pain worsened at night, felt sharp or throbbing, and often returned after meals as if something inside was working again. That belief guided how smoke was used. If the pain was thought to come from a creature or from harmful irritation inside the tooth, then treatment focused on driving it out or quieting it using strong-smelling herbal fumes. Smoke from dried medicinal plants was considered more than smell. It was believed to carry healing power through the mouth and into the aching area. When the smoke reached the throat, it was also thought to cool the system, easing the feverish, restless feeling that often comes with dental infections, even though the actual problem was typically inflamed pulp or an infected tissue around the tooth root. Doctors and healers prepared the herbal smoke treatment with careful steps, even without today's dental tools. First, they selected common local herbs with bitter or aromatic properties, then dried or crushed them so they would burn and release a steady stream of smoke instead of flames. Next, the herbs were placed on a heat source, often something that could smolder, so the treatment produced fragrant smoke rather than sparks that might burn the person. After that, the healer directed the smoke toward the mouth, using a tube, a funnel-like piece of material, or simply by holding a controlled smoke flow near the patient's open lips and cheek. The patient was usually asked to keep the mouth open and breathe the smoke gently so it could settle on the tongue and reach the back of the mouth, where pain signals can feel especially intense. Sometimes the process was repeated in short sessions. A healer might switch to a stronger or different herb if the smoke became mild, because pungent fumes were believed to work more effectively against the tooth worm and the irritating forces inside the tooth. In many accounts of folk practice, the worm was treated as something that could be overwhelmed by harsh medicine, so smoke served as both a soothing breath and an aggressive deterrent. The same lack of modern dentistry that made pain control difficult also meant that many people had to rely on symptom relief, smell, warmth, and the calming effect of fumes, while the underlying decay or infection continued to progress. Compared with modern dental science, the contrast is clear. Today, tooth pain is understood through anatomy and pathology. Cavities can expose or inflame the pulp, bacteria can infect the root area, and inflammation can cause referred pain. Treatments target the actual source: drilling and cleaning, fillings, root canal therapy, drainage when needed, and pain control with evidence-based anesthetics and medications. Smoke-based herbal therapy doesn't remove decay or disinfect the inside of the tooth, so it can't replace those procedures, though it may have offered temporary comfort by numbing sensation slightly, reducing perceived inflammation, or triggering a calming reflex through strong aroma and warmth. In practice, herbal smoke treatment often functioned as a bridge between unbearable pain and the eventual possibility of care. It fit a world without anesthesia and without professional dental instruments, where the goal was to reduce suffering during the time before definitive treatment could be found. The toothworm idea shaped the ritual and made the treatment feel purposeful, while the smoke method used what was available: smoldering plants, controlled fumes, and direct exposure of the painful area through breathing and contact with the mouth. Did smoke actually stop tooth pain? Before modern dentistry, people still faced the same problem we do now: throbbing tooth pain that could come from an inflamed nerve, an infected root, or inflamed gum tissue around a tooth. Without clean drills, proper fillings, antibiotics, or anesthesia, doctors searched for ways to calm symptoms and make the mouth feel quiet long enough to survive the day. One treatment that appears across many folk traditions was herbal smoke drawn near the aching tooth. The belief behind this practice often came from early dental theories, including the idea of a tooth worm or hidden causes inside the tooth. In that view, the pain was not just tissue damage. It was something living or lodged that had to be driven out. Smoke was treated as a force that could chase the cause, and some healers also assumed smoke could dry the area or warm it so the tooth would stop angering the gums and nerves. Even when the exact theory was wrong, the ritual fit the kind of relief people were seeking: less burning, less pressure, and a feeling that the attack was being countered. Herbal smoke treatments were usually prepared in a practical, step-by-step way that looked simple but demanded attention. First, a healer selected strong-smelling plant material, often dried leaves, resins, or bark, because the smoke had to be noticeable and irritating enough to feel like it was doing something. Next, the herbs were set on heat so they would smolder and produce smoke rather than flame, since steady smoke was easier to direct toward one side of the mouth. A small bundle or ember was then used to guide the plume, either by holding it near the cheek or by moving it so the smoke reached the area around the painful tooth. Some practitioners also paired the smoke with other mouth actions, such as rinsing with weak herbal infusions or warming the mouth beforehand, so the smoke would contact irritated tissue rather than just pass by. The process was repeated for short sessions, then stopped if the patient felt too much burning or nausea. So did smoke actually stop tooth pain? Sometimes it seemed to, but the most likely explanation is symptom change rather than a cure for the root cause. Smoke from certain herbs can act as an irritant, and that can temporarily override pain signals the way strong scents and heat can distract attention. It can also reduce saliva flow and create a drying effect, which may make swollen gums feel less plump for a little while. In cases where the pain came from mild inflammation or surface irritation, a short-lived calming effect could be reported even if the underlying problem, such as an infected pulp or a deep cavity, remained. But for true dental infections, where bacteria are in the tissues under the enamel or around the root, smoke cannot reliably sterilize the site. It may mask discomfort briefly while the problem continues beneath the surface. When modern dental science treats tooth pain, it targets what causes it: enamel decay, inflamed pulp, gum infection, or a cracked tooth. Dentists use diagnostic exams, X-rays when appropriate, and then choose treatments like fillings, root canal therapy, gum care, or extraction, often with local anesthesia, so pain control is controlled and predictable. The shift matters because modern care aims to remove or treat the source, not just alter sensation. Historical smoke practice was shaped by the absence of tools for cleaning, sterilizing, sealing, and numbing, so relief was often indirect and temporary. Smoke could feel like relief on demand, but it was not a substitute for treating cavities and infections that keep driving pain day after day. Centuries ago, when a throbbing tooth kept people up all night and there were no drills, fillings, or anesthetic, some doctors believed the pain could be chased away with smoke. Their idea was simple in their world: the tooth was alive, with trouble, and the cause wasn't always an infection you could see. Many early dental theories blamed a tiny tooth worm, a hidden creature that gnawed inside the gum and caused unbearable ache. Even when later thinkers questioned that belief, the method didn't vanish, because it seemed to calm the sensation and drive out the problem. One treatment focused on herbal smoke. Doctors prepared it in a careful, step-by-step way. First, they collected strong-smelling herbs known for soothing or warming effects, plants they believed could draw out badness and calm irritated tissue. Next, they dried and crushed the herbs, so the smoke would carry their strength. Then they packed the herbs into a small heat-ready container, often a brazier or bowl, so they could be burned safely. As the herbs smoldered, the doctor positioned the smoke so it reached the painful side of the mouth, letting the person inhale gently or holding the fumes near the aching tooth. The aim was not magic in the modern sense, but a practical hope. The smoke's heat and scent might reduce discomfort and make the suffering feel less intense, especially when nothing else was available. To understand why this made sense back then, you have to picture the reality. Early dentistry was rare, tooth extraction was risky, and anesthesia didn't exist. Pain relief had to come from what people could prepare with their hands: herbs, heat, and ritual. So even if the tooth worm theory was wrong, the experience of temporary relief kept the practice alive and passed it through generations. Today, modern dental science approaches tooth pain with tools that don't rely on mystery. We look for cavities, gum inflammation, abscesses, and nerve irritation using exams and imaging. Instead of smoke, dentists use targeted treatments, cleaning, fillings, root canal therapy, or antibiotics when appropriate, plus numbing agents that stop pain during care. What changed most wasn't the goal to help people, it was the evidence. We now test causes and match treatments to what's actually happening inside the tooth. Still, there's something worth carrying forward from this story. The human urge to search for relief when you're in pain and you don't have the tools we take for granted. If you're curious how people tried to treat other tooth problems before modern dentistry, especially how their beliefs shaped the remedies, watch the next part, where we follow another surprising historical approach and compare it with what today's research tells us.